Let's Talk NCLEX, and we go over your weekly NCLEX review, but also we encourage and motivate each other. This is a very special Let's Talk NCLEX. You don't want to miss it. And some of you may be asking, well, who are you, ma'am? My name is Regina Callion. I happen to be the best NCLEX instructor in the world, and I work here right at Remar Review. Come on in. We have a very special guest for you today. You guys might know him, very familiar social media influencer. His name is Kev on Stage. Do you guys know Kev on Stage? He has something very special that he wants to tell nursing students. Check it out.
What up, nursing students struggling to pass the state boards? Black Friday's around the corner. Skip the flat screen TV this year. Invest in your nursing career. You finish school, you're just one test away from your license. Regina is here to help. Hit her up. Your boy Kevin on Stage wants to see you do well and pass and save some lives.
Love Kev on Stage. He just wants you guys to say some lives. But what he is talking about is our Black Friday. The event starts next week. It's going to be fantastic. Black Friday deals usually begin on Friday, but we have heard your cry, and we will actually be starting our Black Friday sale on Thursday. It's going to start on Thursday at 8 p.m. So you have to remember for yourself and also tell a friend, because the deals are amazing. If you signed up for our Black Friday NCLEX review, then you already know this, but I'm going to tell those who may not know. So the number one deal that we are doing, which is totally amazing, if you've been following Remar Review for any length of time, you know that we are doing $100 off of our full self-study program. Is insane. $100 off of this program. And let me just tell you what you're going to get. You will get, oh my goodness, you're getting the student workbook, all right, which is what you will take your notes in. I created the foundation of the exam right from this book. Okay, so the major topics that you need to know, you'll get this in your student workbook. Also, you will get in your package, you're going to get your homework book and your practice exam book. Yes, you have homework with my program. You're responsible for looking up information and being prepared for the exam. It's not just something that I just give you, like you have to do work. Not only do you get that, you get the activity book as well, which is a very cool way to study nursing information when you don't feel like doing questions and answers. Also, I've been getting Dorothy, you passed your NCLEX exam. Wow, this is major. Oh my goodness. Wait, everybody, they're coming in. So Dorothy, you have been, yes.
Hold on.
Dorothy, Mark got to get over this one.
Dorothy, what's up?
Congratulations. You've been rocking with us for such a long time. Yeah. I am so happy that you passed. Please, 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 let us see your video. I'm super excited. Like, I can't even tell you how happy that we are for you.
Congratulations.
Yes.
I have to get up on that one. That's awesome.
Yeah,
I've seen her for like months.
Yeah.
Always active and commenting. Love it. Congratulations, Remar Nurse. We are waiting for your video.
Yep.
We are waiting for your video.
Absolutely. We got another nurse Barrow. I passed NCLEX RN on the first try, 75 questions yesterday.
Love
Thank
it.
you.
Congratulations.
Thank you so much for coming on here. Busting in right when I was talking about the DVD package.
Man, get the self-study, guys. It works.
It works.
Awesome. Congratulations.
Thank you. So I was talking about what all comes into that package, and I left off with the two. Actually, you get two new products if you purchase. Not only are you purchasing it for $100 off, but you get the new 5-star quick facts. And I've been getting so many emails about this 5-star quick facts. You guys want to know about it, so I will go into detail a little bit more about it. But anybody who buys the package will get the new 5-star quick facts. So it's just, if there was ever a time when you were waiting to buy, this is going to be the day that you should buy. And not only that, but I created a new product, and I'm releasing it only on Black Friday. And it's something that I worked super hard for. And it is actually this right here. It is the NCLEX Ready Question Bank book. It is the book the question bank book. And I'm telling you guys, this is the package highlight for myself. The package is amazing. Like, the information that you get in the package is amazing. But this question bank book, what it is it's essentially test items that I created. And they reflect what's currently on your NCLEX exam, like the things that you need to know. So all of the questions that I've gotten in the question bank book, there are eight exams with 50 test items in each exam. So you literally have amazing questions in here to help prepare you. So the majority of this book is case studies, because case studies are how you are able to demonstrate that you clinically understand what is happening from the point of admission all the way through discharge. So you'll find a lot of case studies in here. I also have, of course, your integrated processes. You have to know questions on that. Teaching, conference teaching. I'm at a conference. My registered nurses, you know this. And let me just say this. There is a RN and a PN version of this book. So you guys know that is amazing. I didn't leave my PNs out. Every PN package will get the PN version of this book. But for RNs, questions about teaching conferences. When you're at a conference, what do you teach? What else do I have? Oh, which statement needs further education? This is in the question bank book. Interdisciplinary conferences. What is my role if I'm on an interdisciplinary team as the registered nurse, as the licensed practical nurse? I'm telling you guys, this question bank book is the truth. What else? Ventricular assist device, telehealth, what a nursing math, just all the questions that you guys have been sending me. Hey, Regina, how do I prioritize? How do I know which patient to see first? Like, I did it for you guys in this book. So it will be available for Black Friday, and it comes only if you purchase the DVD package. So this is like my gift to everyone who is investing in themselves during this time. This is what will be included. So never seen before. This is the first time that I've ever shown this book, question bank book. It will be available for Black Friday. So I'm letting you guys know, get the package, share this video. Oh, so good, so good. You know those topics are important. So that is the question bank book. It will be included in every DVD package, and I'm so excited that we have finished it and it's being released to you guys. You're gonna love it. You're gonna love it. Okay, so one more thing also that I wanted to talk about was the quick facts here. I have gotten so many questions on this book here, the 5-star quick facts. So I just want to run through the questions that I have about this book. So on Black Friday, you know, normally the price for quick facts is $24.95. But for Black Friday, you will be able to get this book brand new for $19.95. And the 5-star quick facts will not be available anywhere else. So you will not see it on Amazon. You will not see it in Walmart. You will not see it except for right here with us. All right. So the 5-star quick facts. People ask, what's the difference? The old one. If I have the old one, can I still get the new one? Absolutely. We will be selling this book by itself. So you will be able to purchase the new one if you want to. The highlights of the new quick facts are pretty substantial, I would say. I worked really hard on it, and just get my list here. So the first thing that the new 5-star comes with is its own self-study calendar. So you can finish this book in 3 weeks with the calendar that I have prepared for you guys. It also comes with progress planner pages where you get to assess, what do I know? What don't I know from the book? What barriers am I struggling with? So just kind of like journal pages to keep you focused, because the material in here is so important for the exam. And people ask, well, what's the difference between the new one and the old one? The old one is still great. It's the one that people have been using to pass NCLEX all year, right? People have not been using this book to pass NCLEX. They've been using the old one. So I didn't take anything from the old one out. It is all great information. But what I did was I added topics to the new one for you guys. So there are 17 new topics in the 5-star quick facts that I thought was important for you to know for your NCLEX exam, such as Adams-Stokes syndrome, such as Huntington's disease, plasmapheresis. These are things that you need to know before you take your exam. Another thing is the clinical skills section in the back of this book is phenomenal. It is the high skills that nurses do, whether you're an RN or PN. You will do certain skills very frequently, and so you need to know them for your NCLEX exam. All right, so that's added here, and I really think you guys will like the clinical skills because I kept them in steps that are pretty simple for you to memorize. There's also a test associated in this book on the clinical skills to make sure that you have studied and retained the information. Another feature of the 5-star quick facts is that in this book, the pharmacology section has been redone. So if you look at it compared to the old one, I have actually scrubbed out all of the brand names. So there are only generic names in the new 5-star. I have also redone the teaching in the pharmacology section to be more focused towards client care and client safety. And another thing that I did in the back of the 5-star is I redone the questions that are in there. So you have 50 next generation NCLEX style questions. So of course, case studies, a lot of graphics are in here for you to interpret. Very, very cool. So you're able to get this book with the DVD on Black Friday. The DVD is only $10. Only $10. I mean, these deals are amazing for you guys. And people have been asking, can I still use this DVD with the 5-star? And you can. I actually will not be doing this DVD again until later in 2019. So get this DVD to study your book because, like I said, I have not taken anything out of the old quick facts for this book. It's all in there. So the DVD will help you to study the book together. All right. So, so good what we're doing here. I wanted to really show this when I'm talking about the package, literally, I'm talking about the package. It is a 6-week program. All right. It's a 6-week program. And I thought about this. If you take the $100 off and you purchase this package for $189 only, like most NCLEX reviews are $500, $350. On Friday, this total package will be just $189 for 6 weeks worth of training. That is literally just $30 a week. That is less than $5 a day to get your nursing license. So we have made this super, super affordable for anybody that is willing to invest $5 a day into their nursing education. And we've added new products for you all as well. Read My Review, we're really working hard. The whole team is really working hard to connect you to the products that you need. So without further ado, again, if you signed up for the event, you already know this information. I will also be doing a live NCLEX review on that Friday, starting at 3 p.m. So I really need you guys to sign up for it so that you can get the information. You can get the workbook, everything, okay? What if somebody, can you purchase the 2 new books if you have the package? You can purchase the Quick Facts book. You can purchase the Quick Facts book alone separately. The question bank book is reserved only for those who have the package, right? And we just have a limited quantity of those. So right now, it will only go to those who purchase the entire package. But you can still get your new Quick Facts on Black Friday for $19.95, okay? And the DVD as well, all right? So that is that. The question bank book will be reserved just for those who purchase the complete package as a gift, as a bonus for you guys, all right? So if you have any questions, I will spend some time on the back end. This is Let's Talk NCLEX. I'll spend some questions on the I'll save some questions for the back end to talk about Black Friday again. But we have Let's Talk NCLEX. One more thing about the workbook. It is coming out on Monday. I've gotten tons of emails about the Monday. Hey, Nurse Elizabeth, you passed your NCLEX exam already. She says, I'm a true REMAR nurse. I use everything REMAR. No UWorld, but just REMAR. Why, thank you very much. That is an amazing testimonial to the products and the love that we put into them for you guys. Thank you for trusting REMAR Review to help you get your license. We're growing specifically based on the success of you guys. So every time that you come on here and tell that you passed, every time that you come on and tell that you passed, it helps to motivate somebody who used to be in your shoes. So let's talk NCLEX. Are you guys ready? Our first question always comes from Instagram. If you follow me on Instagram, then you know every week we put up an NCLEX question. So here it is. It's pretty straightforward, pretty straight to the point. REMAR nurses, can you name this condition? Just look at the condition. Give me your best guess. I'm not giving you any options. I just want to know if you can name the condition. Oh my goodness. They were guessing. All right. So the answer, I see the questions coming in. The answer actually is yes, chickenpox. Chickenpox is the correct answer. And we know that it's caused by the varicella zoster virus. Patients who get this are usually contagious. It is transmitted through airborne precautions. If you look at the CDC website, you will see that it says airborne and contact. But for your NCLEX exam, you always want to go with the highest level of precaution, and that is going to be your airborne isolation for anybody that has varicella for your exam. So just protecting yourself. Yes, chickenpox, varicella, very good. All right, you guys got it. That was kind of an easy one today, but it's a reminder that anything can be on the NCLEX exam. Now, let's get started with our question that was on Facebook. Here we go, guys. Here we go. A nurse is caring for an adult client admitted to the psychiatric hospital for shoe tying rituals. The day after admission, the client is scheduled for an X-ray. How should the nurse ensure the client is on time for the X-ray? Puerto Rico's in the house. All right, so we have the scenario. We're trying to ensure the client who has shoe tying rituals, we want to make sure they're on time for their X-ray. So we're going to focus on psych here today, obsessive compulsive disorders. Here are the selections. Should the nurse inform the client that adults have to be accountable for their actions? 2, limit the time for shoe tying rituals during the morning. 3, remind the client of the diagnostic procedure several times. Or 4, allow the client ample time to tie his shoes. Which one is best to make sure that this client gets to that diagnostic procedure on time? Everybody looks like they're picking the answer number 4, allow the client ample time to tie his shoes. Is there another? I see 3. Okay, remind the client of the diagnostic procedure several times. Olivia says, I said 4. 4. Yep. Percy says 4. Nancy says, I say 2. Remind the client, limit the time for shoe tying during the morning. Limit the time. What should we do? This patient loves to tie their shoes. All right, here we go. The correct answer is going to be number 4. You got it. You guys got it. We need to allow the client ample time to tie his shoes. Remember, patients with obsessive compulsive disorders, such as shoe tying rituals, well, the tying of the shoes helps to reduce their anxiety about certain situations. So when we have them in a hospital environment, well, that is a very anxious time. So we need to allow them an ample amount of time to perform their rituals. And this will help reduce anxiety so that they can perform other tasks like going for diagnostic procedures or learning about medication. So this is the principle that I want you guys to remember if you encounter a question like this on your NCLEX exam. Now, let's try it again. I'm going to give you guys another question. I want you to think about what we just learned, and I want you to apply it to this question. Here we go. Next question is, a nurse is caring for a doctoral student who is overly concerned about hygiene. She admits to obsessively washing her hands 20 or more times a day. Which goal is most appropriate for the first week of treatment? Okay, so this is another question along the same lines. Here are our choices. We're looking for the goal that is most appropriate for the first week of treatment. Client will spend no longer than 2 hours a day washing hands. That's number 1. 2, client will spend no longer than 1 hour a day washing hands. 3, client will spend no longer than 30 minutes a day washing their hands. Or 4, client will spend no longer than 5 minutes a day washing their hands. We're looking for a goal that's most appropriate for the first week of treatment. What saith you all? This one might be kind of tricky, and you may not have encountered a question like this. And really, when this happens to you on your NCLEX exam, all you have to fall back on is your content and what principles that you've studied. So this is not a place where strategies are going to work. Like, you really have to think about, well, what have I studied? What have I studied? So I see 2, 3. Think about what we studied in terms of this. You have a client that is washing their hands 20 or more times a day. Very good. I see everybody coming in. Yep. 3, I'm thinking safety. Okay. 1, okay. Right? So 4 is just 5 minutes, right? No. So we have to remember what we've learned. And so the correct answer is going to be the very first one. The client will spend no longer than 2 hours a day hand washing. And this is simply based on the principle that we need to give clients with OCD an ample amount of time to perform their rituals. So this gave that client, number 1, gave that client the most time. Imagine if in the first week of treatment, for somebody who washes their hands 20 times a day, for the nurse to say, okay, we're going to, in the very first week, just give you 5 minutes a day to wash your hands. Well, that will not do very well at all, and the patient will not be able to meet that goal. So thinking about that principle, it's something that you can carry with you no matter what type of questions that you get about obsessive compulsive disorder. You understand now how your focus should be thinking as a nurse. You understand how you need to interact with this client. So we don't rush the client. We don't constrain them to a certain time limit to perform their rituals. We give them the most time that we can. Okay. So I think you guys are understanding this principle. Very good. Let's do one more. Let's do one more. All right. All right. A nurse is reviewing information with a client about what symptoms are present during a panic attack. A panic attack. Which signs should she include? Select all that apply. So when we have select all that apply questions, we're simply just demonstrating what we've studied about the topic. And the topic here is panic attacks. So what do we know about the signs of panic? All right, specifically the panic attack. So these questions love you too, Olivia. These questions love you too. All right, so what do we have here? Lethargy. Should we include it? Should we not include it? The next one is shortness of breath. Will we see that? Delayed speech. If our client is having a panic attack, will there be delayed speech? What about sweating? Will we see sweating? 5 is dizziness. And 6 is rumination, which may be a new word for some of you guys. And if you don't know it, well, I expect you to look it up because it is a clinical term and you need to be familiar with it. Don't let today end without you knowing what rumination means. All right? So rumination, I see the answers coming in. You guys are thinking 2 and 3, 4 and 5. People are like, I don't know what rumination is, Regina. I'm not going to pick it because I don't know it. Somebody needs to look that up. And this is all how you do your select all that apply. It's really based off of what have you studied? What have you studied? All right. Very good, everybody. I'm getting a lot of good choices. This is what we do. If this is your first time here on Let's Talk NCLEX Fridays, oh, you're in for a wonderful treat. This is what we do every Friday here at Remar Review. You got to share the video. You got to like the page because this is what you'll get. And next Friday during Black Friday, we're going to really do it up because I'll be doing a full review from subjects right from the DVD package. So you want to make sure that you're here 3 o'clock. Deep thought. Okay, so very good, everyone. Let me reveal to you the correct answer. It is POW. Number 2, during a panic attack, absolutely, your patient will have shortness of breath. They will feel like the room is closing in on them. They will not be able to breathe. Also, you will have sweating during a panic attack. That is number 4. So 2, 4. 5, dizziness, of course. Yes, a lot of you guys picked that. And then as well, you're going to have rumination, which is repeating the same things over and over and over and over. Okay, over and over and over and over and over. There will not be lethargy. Your patient's not going to be tired, and there won't be a delayed speech in the sense that your patient is having difficulty speaking in terms of the clinical delayed speech. So you would not expect that in a panic attack. All right. So those are your symptoms. And actually, I thought I had the book in here. Where is it at? Do I have the book? I pull questions from clinical resources. The one thing about the question bank book that I think is really cool is that I had to purchase, I had to study multiple different textbooks in order to get all of the questions that I got in the question bank book. I had to really research multiple topics, like, those questions about interdisciplinary conferences. You will not find those in NCLEX reviews. Like, no NCLEX review has those type of questions. The telehealth questions, I had to really study telehealth in order to make questions for you guys. The the case studies, like, those are really not present right now. And so I got the psych questions today from my psychiatric nursing book. I love this textbook. It's one of my favorites. So I got all the symptoms and things right from there. So just so you guys know that I'm not just on here making up questions. Like, I conform the things that I provide from you, the things that I provide to you, I conform them to the test plan. I do extra research. I spend time really, really, really studying the scope of practice of nursing so that we can learn the information together. All right, learn information together. So cool. This is my plug for the question bank book. It's really, really good. All right. So Black Friday again. And when people shop for Black Friday, sometimes they're thinking about Christmas gifts. And so I was thinking, oh my goodness, what would be the best Christmas gift to give to yourself or your nursing friend? It is going to be that 5-star quick facts. But look at what Santa brought to this wonderful town. He brought knowledge. Shout out to Robert for putting together this photo shoot for Quick Facts and the self-study DVD. Give the gift that will literally keep on giving in terms of your financial success, in terms of a wonderful nursing career. Remar Review, with the products that we have, we are crushing this nursing shortage that people say exists. We're going to end the nursing shortage right here with the Remar Nurse community, because all of you guys will have your license. And you can have your license actually by the new year if you purchase the Remar products Black Friday. You study for 6 weeks. That new year 2019, oh my goodness. The new Quick Facts book for you guys that are just coming in, 5-star Quick Facts, is available starting Thursday night at 8 p.m. And it will be available for $19.95. Super affordable. This is our gift for Black Friday. We wanted to be a part of it. Last Black Friday, we had a great time all day doing the NCLEX reviews. I will also be going live starting at 12 p.m. that day, and I'll be doing questions from this book. So you can test your knowledge to see if you already know the information in here. I'm going to go over the clinical skills section. I'm going to go over the pharmacology section, and we're just going to have a great time studying with Remar products all day long for you guys will be purchasing. I'll be shouting out my usual suspects here at Remar Review. So right now, the question bank book is only available to those who have will have the package on Black Friday, and that's just because we have just a limited supply of this book. But if we have some left over, we may make them available. But right now, the priority is for our nursing students who are making an investment in themselves during this time, making an investment in themselves, or for somebody else pre-ordering. At this time, we're not taking pre-orders for any of the products. We just want to have you guys really to sign up. The full package will actually be $189. It's $100 off of the full program. So $100 off of the full program, $189 for 6 weeks. That's $30 a week. That's $5, less than $5 a day for your nursing license. So Black Friday, I will be talking about it on Monday as well. I'm looking forward to Black Friday. It's going to be a wonderful day. Thursday, spend it with your family. Friday, spend it with your Remar family. Okay, guys, I'm going to get out of here. Guys. We can, you guys know our motto, Remar Review. We can, we will, we must pass NCLEX.
What's up, guys? I got to interrupt the end of this broadcast. She's about to get off of here.
Yeah.
But what I want to do actually is say two things, right? So at Remar Review, we are faith-based, essentially. It's just because that's who we are as individuals. And I know a lot of you can connect with that and relate to that.
Yeah.
So you see that the new products are available, new products are here. But what you also saw is that during this very video, this feed, two nurses that have been studying with us for the past few months, they came on and said that they passed NCLEX, they have their license now. And that's exactly what we want for all of you. So listen, don't let fear take over and say, oh, I have to get this new thing. I only had the old package. People are passing with the old package. The old package is still the best review available. You have the best materials. So we're just providing additional resources to help you along your way. So don't allow fear, don't allow anxiety or anything like that to come into your mind and to take that away from you. The last thing I want to say is I want you guys to pray for Regina. Her voice, her voice and her health. Right now, she's not 100%. Even at 80%, I think you're still top of the game, though.
Thanks.
But no, seriously, pray for Regina, and so that she is strong and that her voice is great. So that on Black Friday, when it comes for the all-day review, and she's actually going to go on starting around 1 o'clock, I believe. 12 noon, 1. What? If you guys sign up, you'll get all the details by email. Sign up now at remarreview.com to make sure that you're up to date on everything. A lot of questions that you've been asking will go out to those people that signed up, and we have some special things in store. But most of all, I want you guys to pray for Regina, that her health is strong, and that's so that on Black Friday, she's able to come and make that presentation. All right, so I'm counting on you guys, and we know that you're going to come through. And make sure that you share this because a lot of people need this information.
Absolutely.
All right. So with that, we are out. We will see you Monday for Monday Motivation.
Monday Motivation,
Monday Motivation, guys. All right. Take care. Bye-bye.